I did both proximal as well as distal locking while freehand technique. And number 3, we have added a color-coded tibial and extractor or more improved version of the color-coded tibial and extractor for RCT nail introducer compositioner to introduce the nail inside the intermedullary canal in proper position. So these 3 changes makes this innovative technique as a very, very cost-effective way of doing suprapatellar nailing of tibia. So friends, this is not a Jogaru technique. This has very strong mathematical or scientific basis. After jumping so many steps of mathematical equation, we had come to know that the success of interlocking nailing is equal to K into C into P into Z. Whereas K is the expertise in the art of the freehand technique of locking, whereas the C, P and Z are the respectively the availability of the C arm in your OT and protective sleeve in your special instrument set and G in your special instrument set. If you increase the value of K to such an extent that the Z becomes 0, that is dependence on the G becomes 0, this creates a scenario where the surgeon has mastered the freehand technique of locking and can perform both proximal as well as distal locking without the G. So this is the mathematical basis. We conducted a study between March 20 to March 22 5 on 100 cases of non-articular fracture of the tibia done by Dr. Thakur innovative technique of suprapatellar nailing of tibia. So along with the other instruments, we had 2 pilot instruments. Number 1, a color-coded tibial and extractor, which is present in intrapatellar nailing set, and a more improved version of the color-coded tibial and extractor called RCT nail introducer compositioner to introduce the nail. This is the skin incision. You can see the transverse incision has been given, but you can give vertical incision also. And this is the innovative part of this innovative. Second picture shows the innovative part of this innovative technique, the introduction of the trocar and protective sleeve from PFN A2 set inside the retropatellar space. And the third picture shows the innovative part of this innovative technique, that is the proximal locking by freehand technique. So after making a hole just medial to the lateral tibial spine, we introduce a malleable guide wire. After percutaneous reduction of the fracture with the percutaneous forceps, and after serial reading, we mounted a appropriate side nail over the color-coded tibial and extractor or RCT nail introducer compositioner, and finally we introduced the proximal as well as distal locking by freehand technique. So this is the flow diagram, nothing to repeat it again, and this is the post-operative follow-up steps. Again, you all are aware of this. This is same as the intrapatellar nailing of tibia. No patient complain of knee pain in our series. All patients get full range of movement in our series by 16 weeks. At final follow-up, 84 cases found excellent results, whereas 30 had good results, whereas 2 had subacute infection at the screw site and 1 had infected non-union. The average time of union was 80 plus minus 10 minutes, whereas average fluoroscopy time was 38.5 plus minus 6.5 seconds. All patients followed 2, 3, 6, 8 and 12 weeks, and the average time of the union was 8 weeks post-surgery, whereas complete union occurred by 12 weeks in all our cases. These are the few cases, clinical as well as radiological pictures of the few cases done by Dr. Thakur innovative technique of suprapatellar nailing of tibia. So the number of studies done on this innovative technique is small. I think this is the only study done by me, although good number of patients were included. The study was not comparative with the standard technique, so a status of cartilage over the pipeline trochlea was not evaluated in this study. Those furthermore studies required to compare this innovative technique. We had a high-tech presentation in IOACON and found a space in International Journal of Orthopedic Sciences. You can see, and this is a video we don't have time to show you. So the take-home message is this technique would prove a boon for small and medium-class hospitals situated in BSC, Great Town, in India and poor countries like Bhutan, Nepal and Bangladesh, where the allocation towards the health is very, very low. So this could prove also a very useful technique for Ayushman Bharat Yojana, which is the dream project of our Prime Minister, Shri Narendra Modi. Thank you very much for patient hearing.
Choose from thousands of realistic voices to use in your content. Change the way you record podcasts, voiceovers, and branded content with the #1 AI-powered voice-generating technology. Stop searching for the perfect voice and stop wasting time re-recording take after take. Try 11 Labs for free and start elevating your content today.
Hi, so can you tell me your name and which company you work at?
My name is Rashmi and I work at TCS.
Interesting. So I'm going to show you a dashboard, and could you let me know how long you would take to make something like this?
There are many steps involved, right? Like you'll have to probably organize the data and then like apply some formulas, I'm guessing, and then to make the chart and then analyze it. I think 5 to 6 hours roughly.
Okay, so will you join my course if I make this exact same dashboard within 2 minutes?
What? How is that even possible? If you can do it, then yeah, sure, why not?
And done.
Wow, that's crazy. How do you do that?
So I used AI features from MS Excel, and in my course, you'll be learning how you can use around +300 formulas without even memorizing even single one of them, and you can automate 95% of your work. Along with this, 3 to 4 hours of your work may be done within minutes with 100% accuracy. So now can you guess how much a course like this would cost you?
2,000, 3,000 rupees, I guess.
Not at all. So this course is priced exactly at rupees 99, so that all working professionals could make great use of it. With this, you'll be able to reduce your work stress, manage your workflows, and above all, you'll be able to grow 3x in your career. So, if you want your career to get the same AI boost, register for the workshop right now just for rupees 99. And hurry up, just 6 seats left.
The traditional teaching that the 99.99% of these cases unites without any significant deformity and without any significant functional impairment. But later on, it was found that there are severely displaced fractures, severely committed fractures. About 15% of cases require surgical treatment either in the form of dense nailing or the internal open reduction and internal fixation with plating. So let us come to our main topic, that is dense nailing. Unlike conservative management, it provides stable fixation and early mobilization and reduce the risk of non-union and malunion. Dense is less invasive, resulting in a smaller incision, reduced soft tissue damage and fewer potential complications, making it an attractive option for managing displaced fracture of the clavicle. So we conducted a study between March 2022 to March 2025 on 25 cases of clavicle fracture, mid-third fracture, all were simple displaced fracture according to AO classification 15D1 and 15D2. The age of the patient was 16 to 48 years. No comorbidity was found in our study group. So all patients treated by titanium elastic nailing in my hospital. So the mode of trauma, road traffic accident was the main mode of the trauma, whereas fall from height and fall on out the step head was the other mode of the trauma. So these are the typical mode of injury, the fall on the shoulder to protect the head injury in the road traffic accident. This picture is taken from AI, and this is a typical clinical presentation, a bump at the site of the fracture, and the skin appears as if the fragment will penetrate the skin. And this is the radiological typical presentation, more than 2.5 centimeter displacement, and the dead type of cognition are the radiological indication for the surgical treatment, either in the form of tense or internal fixation with the plate and screw. So these are the already explained. The simple fracture were taken into consideration, displaced simple fractions, either spiral or oblique or transverse or short oblique, 15D1 and D2. The patient lies supine we are affected, elevated, and the arm are hanging outside the table so that we can facilitate the abduction and external rotation at the shoulder to facilitate the reduction of the fracture by closed means. The incision is small incision, either transverse or longitudinal incision, about 1 to 1.5 centimeter, just lighter to the sternoclavicular joint is given, and after making an incision, we make a hole with the help of drill bit, and then we make this hole continuous with the intramedullary canal of the clavicle. But this is very, very crucial still. One should take his own time and use tips and tricks to do this step, because the heart and lung, like vital structures, are waiting for an instrument to escape. So after making the hole, we did snelling after close reduction or mini incision reduction. So the immediate post of pain management and immobilization, at the 2 weeks we did suture removal, at 6 weeks radiographic assessment of the fracture area, at 12 weeks the functional assessment, and if required the implant removal was done. And the operative time was 30 to 60 minutes, whereas fluoroscopic time was 10 to 30 seconds, and the blood loss was 20 to 50 ml in all our cases. So the excellent result in 76% of cases, whereas 16% cases were good results, and fair and poor results were 4% each in our study group. The complications are nail bypass, superficial infection, and the malunion, each were 4%, whereas hardware irritation was 8% in our study group. And these are the few cases. You can see that 15B1 fracture treated by titanium elastic nerve, beautiful surgery without the use of any instrument. The reduction has been done only by shoulder movement, external rotation and abduction, and with the help of the thumb and index finger. The beautiful surgery. And this is another case, yet another case of the 15B1 fracture treated by titanium elastic nerve. Yet another case